Hi, it's Matthew Dixon of MindAid, and I had a thought yesterday about what's happening with the virus this summer in 2020, and people are all around the world are worried about what's going to happen to. There's a lot of uncertainty and anxiety about what's going to happen, and Africa is lagging behind in the number of cases, but people are really worried about what's going to happen there with the virus and how people are going to cope with it. They have fewer resources than other countries, and other countries too. They're so. One of the things I fight for is mental health in developing countries, and this has been talked about by the World Health Organization and other groups around the world for decades now, but it still is not mainstream conversation globally. And a lot of the people I talk to say, I didn't know that some countries have one psychiatrist per million people, and that some people are actually kept in chains in some countries with mental illness. And I'm trying to advocate for that and make that mainstream conversation. I think that if everybody simply knew about this, there'd be millions of people who'd want to help in some way, whether it was giving a small donation to starting a fundraiser to creating their own charity to help. And I got thinking yesterday, well, will this virus is causing so many people to talk about their own mental health. So many people are experiencing anxiety and stress from this. And I'm thinking, well, when Africa, as sad as it may be, it might hit them harder than other countries. That's of course horrible. I'm thinking, will this be a time where we start thinking about the mental health of Africans and other developed countries that may get hit hard too? Will this be the time when when this conversation will be brought up mainstream, and groups that I help advocate for, Find Mind and Basic Needs US and Strong Minds and the Minds Foundation, and lots of other groups too around the world. These groups for the most part are small and they need a lot more help. They help people with mental illness in developing countries. And I'm thinking, will this be the year that this becomes mainstream conversation? I'm really hoping. Anyway, that's my thought yesterday, and just wanted to share that with you. Thanks. See you.